So when we need information on a complicated matter, well, what do? You go open the search engine, you punch in a topic, and you go. But isn't it always a little more comfortable and you feel a little more confident about being able to hash something like that with a real human being, somebody that's equipped for the answers and has the expertise to help?
Oh yeah, especially when it comes to something that might make your head spin, like, I don't know, Medicare. That's exactly what the Delaware Medicare Assistance Bureau was formed to help advise you on. And we are so happy to welcome in Trinidad Navarro. He is the Delaware Insurance Commissioner. He's with Lakia Turner, the Director of the Delaware Medicare Assistance Bureau. Good to see you guys. Happy New Year.
It's good to be back.
Yeah, good to see you. Okay, so before we talk about the Bureau and what you guys do, why do you think people get so intimidated with Medicare?
Well, it's confusing. You know, there's commercials that you see on television that are misleading. You know, people often want that plan because they saw that person. Doesn't mean it matches what they need, right? So that's why, as a regulator, it's so important for me to try to curtail these misleading commercials. And we've worked with Congress and CMS to get those commercials off the airways. So you don't see them now, like you did just a few years ago. And so that what they were doing is they were signing up people for plans that didn't fit. And that's why it's so important that our DMAB personnel help people sign up for these plans which best fit them. We've saved people millions of dollars over the years and helped thousands of people sign up.
So DMAB, Delaware Medicare Assistance Bureau.
Yes, sir.
Okay, so what is the mission of the Bureau?
So our goal is to empower Medicare beneficiaries to understand their insurance and make an informed decision based on their medical needs. So we provide free one-on-one counseling to Delaware Medicare beneficiaries. That our hours of operations are Monday through Friday, 8 a.m. to 4:30 p.m. So we have counselors on hand that is able to assist those consumers.
And of course, the Bureau can help people with billing problems and other things like that, maybe other savings.
Definitely. So right now is the Medicare Advantage open enrollment period. And during this time, anyone who has a Medicare Advantage plan can change their Medicare Advantage plan to enroll in a plan that includes prescription drugs or does not include prescription drugs. They can go back to original Medicare, and they can also choose a standalone prescription drug plan. So we do assist with billing issues. So if someone has a billing matter with their Medicare Advantage plan, or we understand that a lot of Medicare beneficiaries have a hard time choosing between medications and purchasing food. So there are financial assistance programs that are available, and we screen all callers for that financial assistance.
So now, these are volunteers, right?
No. Well, we have volunteers.
You have volunteers.
But
who trains volunteers?
Our office trains
You do that.
volunteers.
You do the volunteers. Okay.
Actually, yes, and we there's actually an assistant director who actually provides hands-on expertise to those volunteers who would like to volunteer with our program. And we're always looking for volunteers down in this area. So if anyone is interested in becoming a volunteer, that would be great. They can contact our office. We do provide extensive training so that they can help those in the community.
Do you think people, when they try to navigate through all of this, just blindly sign up for stuff, or maybe just even give up?
Just get frustrated with it.
They do, and oftentimes when they do sign up, it may not be the best fit, but they're like, well, you know, it worked last year, and they don't think that they should shop around. And for any line of insurance, we always tell people to shop around, but specifically here because it's so complex and confusing. And just, a minute, she touched on so many things, and there's so many more topics that we help people with when they sign up that they otherwise wouldn't know. And the best part is, it's free.
It's free.
It's free. Yeah.
It's free.
That is the best part. All right. Remind us of the details of open enrollment. And we have, it started on January 1st?
It runs January 1 through March 31st. It is a one-time change that they can make, and the coverage will begin the month after they enroll.
All right. And of course, we'll have a link to your website. Folks can get a hold of you if they have any questions, need assistance in getting what is perfect for them when it comes to Medicare. Thank you so much.
Thank you so much
for coming in.
Thank you for the opportunity. This is a wonderful program.
Thank you.